Welcome back to my YouTube channel. This is Livina Oduji. We're going to continue on CNA Test-Taking skill, and today we're going to start on part 2. The first video that I made, I stopped at avoid asking what if. Now, if you have a question, don't start thinking too much into that question. Do not read into the question. I said on the first video, you need to focus only on the information in the question. Read every word and decide what the question is asking. Look for strategic words. What are the strategic words? It could be, what is the most appropriate, least appropriate? What is the first thing or the last thing you will do? These are strategic words you need to look into when you are answering questions. And again, use the process of elimination. You might not know the answer right away, but with the knowledge of elimination process, you might be able to choose the right answer. Now, when we talk about elimination, when you are doing elimination or using elimination method to answer your questions, especially those ones that you don't really know, eliminate options that has close-ended words like all, always, must, only, none, every, and never. Example, maybe there is a question that says, every resident in a nursing home have dementia. All residents in a nursing home, they are dependent on people for their ADLs. And you know those answers are wrong, because not everybody in that nursing home are dependent, 100% dependent on the aides. Not every CNA resident in that nursing home are dementia. So you know those words with every or always, all, they are not the right answer. Options that contain open-ended words like may, usually, normally, commonly, or generally should be considered as correct options. Example, the previous example that I gave saying every resident in a nursing home have dementia. And I say that word every makes it wrong. But if you have an option that say usually or in a nursing home, maybe most of the residents are usually have dementia. Not all of them. You know, just I hope you understand what I'm trying to say here. When you say commonly or usually or normally, people in a nursing home are those ones of 65 years and older. I said usually. But you know there are people younger than 65 that are in a nursing home. So that option would be the right answer. But saying everybody, all the residents are 65 years and older, all, you know, is wrong. Even though we know that nursing home normally is for people of 65 years and older. I hope you get exactly what I'm saying right here. Another point you have to use when you are answering question is delegation. Again, I said in the previous video that you need to know your responsibility as a CNA. Now, under this delegation, you want to focus on the information in the question and what task or assignment is to be delegated. Always think about the job description or your role as a CNA. You might be a nursing student, or you have finished your nursing school, but you have not passed the board. You are not working in that facility as a nurse. Even if you know what to do, how to do check, how to do injection, but you are not working there as a nurse. You should know your role as a CNA. Now, there is 5 rights of delegation that must be used when assigning care to others. They are the right person. Meaning, do you know the person your nurse is asking you to take the vital sign on? You might have Mrs. Jones, 2 of Mrs. Jones in your hall. Your nurse say, go get me Miss Jones' vital sign. Did you ask which Miss Jones? You want to ask the right task. Not everything your nurse say you should do that you will do. Does the state allow you to perform the task? In a nursing home, you are not supposed to do check, checking blood sugar. You are not supposed to give injection. You are not supposed to give medication. But you are not saying, could you go and do this for me? Because she knows you are done with your nursing program. Are you working with AVN or RN license? The one of the 5 rights of delegation is the right circumstances. Do you have experience with the task given, the conditions, and the need? You might be able or allowed to do that task, but under certain circumstances, you are not required to do that. The nurse is supposed to do that thing, even though under normal circumstances say, yes, you can do it. But there are some circumstances that warrants the nurse to do that task by him or herself. Now, the right direction and communication. Your nurse asks you to do something. Did you get clear direction and instruction from the nurse? That's one thing you need to ask. Your nurse asks you, go get me Miss Jones' urine sample. The urine sample, how do you want to get it? Is it clean catch? Is it routine urine collection? You need to get clear direction and instruction. Your nurse asks you, get me vital sign of all the residents on your assignment. Let me know if any of them has abnormal vital signs. Hello? You have 10 patients. How will you know the one that is abnormal or normal for each patient? Get direct and clear instruction from your nurse. Another right of delegation is the right supervision and evaluation. Now, is the nurse available to answer your question? Is the nurse available to guide you through that process? When you finish your CNA program, pass your test, which I know you're going to pass after watching this video. Now, you go to your facility and your nurse tells you, oh, Miss Jones has to get up for breakfast. Miss Jones is a Hoyer lift transfer. And you know the school didn't teach you how to use a Hoyer lift. This is something you will learn on the job. But you don't know how to use the Hoyer lift. Or maybe you've witnessed it during your orientation. But now that patient is on your assignment and you need to get that person up for breakfast. Did you tell the nurse that, please, I've not really done this on my own or by myself, even though Hoyer lift is 2 people transfer? Did you ask the nurse to watch you, guide you, at least you try it for the first time? the right supervision and evaluation. Don't do something that you are not adequately trained to do. If you have all these things in mind, when you are answering questions, you will be able to figure out the right options. Now, the RN cannot delegate some activities to AVN or CNA, also known as unlicensed assistive personnel. Anything that has to do with assessment, evaluation, nursing judgment, client, resident, or family education, counseling or evaluation, or nursing diagnosis, this is what the RNs will do. The AVNs assist the RN implementing a defined plan of care and to perform that procedures according to protocols. The AVN is capable of taking care of patients that are very stable. As a CNA, you are unlicensed, meaning you don't have license and you don't have scope of practice. Nursing tasks that may be delegated include non-invasive and non-sterile treatment. You are not allowed to do wound care that requires sterile technique. You will assist in direct resident care activities or tasks. Remember ADLs. This is our major skills. You can see that blood glucose check is one of those skills in this slide. But in nursing homes, you are not allowed to do so. But in a hospital, yes. And you know the CNAs in the hospital goes through other training from the hospital before they can do that. Now, CNAs can do some indirect skills like, keeping the residence area clean, transporting residents, and sometimes, keep stocking supplies. If you know this, what you can do and what you cannot do, you will be able to answer your questions. Because AVN or the RN in charge is your boss, doesn't mean you will do everything they ask you to do. There are things you will not do, even if they ask you to do it. If you know that what the task they're asking you to do is beyond the limit of your role. Imagine this nurse asking you to go and remove a Foley catheter on your patient or put Foley catheter. Even if you know how to do it, maybe from where you work or from the country where you came from, it is not your duty. If it's not in your job description, you have the right to refuse. If you know that these things can harm your patient, you have the right to refuse. If you know that their patient's condition has changed from normal to something else, you have the right to refuse that. Now, examples of tasks that cannot be delegated to you. Giving medications. Some of you have worked in group homes, have worked in assisted living, where they train you and tell you how to give Mr. and Mrs. A and B some medications. And you think you can do so, or you think, yes, you did it at a former place of work, and you think you can, it is part of your duty. It is not. And as a CNA, you cannot delegate any duty also to another person or any CNA. And you cannot supervise others. Let's take a look at this question. A patient needs help with their morning hygiene routine. What tasks can a CNA perform? Assessing for skin breakdown, applying a topical cream to a pressure ulcer, brushing their teeth, monitoring for signs of infection. If you look at these questions, we will answer these questions using two different methods. You might know this answer right away. Brushing their teeth, ADLs, hygiene. That is the right answer there. But somebody might be wondering, assessing for skin breakdown. I think we look at our patients and we report if there is any skin breakdown. You are reporting their observation to the nurse. It's the nurse that will come and assess for that skin breakdown. So don't get this mixed up. Monitoring for signs of infection. If you notice that your patient is having infection, yes, this is observation you made. You have to tell what? The nurse. But the task here is brushing teeth, which is number C, the correct answer. Question number 2. Which of the following tasks of a patient with stable vital sign will be safely delegated to a CNA? Administering insulin injection, changing a wound dressing, assisting with a bed bath, performing a urinary catheter insertion. I hope you will just answer this question. Among these 4 options, which one can you do? Again, the answer is C, giving bed bath. Maybe sometime your nurse asks you, please, could you put this band-aid on Miss Jones' wound? It's non-steroid dressing. You just put that band-aid on Miss Jones. That doesn't make you changing a wound dressing. I hope you get that right. The answer is C. Question number 3. Which of the following is a typical task that a nurse aide performs? Changing a sterile dressing on an open wound, helping residents with elimination needs, administering medications, and prescribing treatments. We've seen another wound care here, sterile dressing. You cannot handle anything sterile. What about elimination needs? We take care of Miss Jones. We take them to the bathroom. They have bowel movement. They use, urinary system. These are the things we do. We don't administer medication and we don't prescribe any treatment. We are not the doctors. So the answer is B. 4. Which of the following tasks is outside the scope of practice for a nurse aide? Outside. So another thing we need to understand is we need to know when question is asking us for something we will do and things that we will not do. Because people jump into conclusion even without reading or understanding what the question is asking. In this question, it's asking, what is the task that you cannot do? It's not what you can do, like in the previous questions. Now, giving a resident a bath, are we supposed to do that, yes or no? I hope you answer it yes. Inserting a tube into a resident's body, when did we start doing that? I hope you know you can't do that. Helping a resident eat dinner, transferring a resident from bed to a chair. A, C, and D, there are things we can do as a CNA, but inserting a tube into a resident's body is the nurses. It's not what we do. Example of this tube is when you catheterizing somebody, when you putting catheter inside your patient. It is the nurses. So in this answer or question, the answer is B. Things that we cannot do not things that we will do. So pay attention, close attention to questions. Know when it's asking you what you will do or what you cannot do. Question number 5. When should a nursing assistant identify a resident? I put this question because so many people or students in my class, they normally get this thing messed up. But somehow it's kind of a little confusing. After giving care, when collecting meat trays, when shift change, or before helping with feeding. Now, we can use elimination method in this question. Now, when are you supposed to know that this is Miss Jones? Is it after you have finished giving shower, do everything, now you start, realizing, is it Miss Jones or Mr. John? Again, collecting meat trays. These residents have finished eating in the dining room or maybe in their room. You didn't identify this person before you give him or her the tray. When are you supposed to identify this resident? Is it when you are collecting the tray after they have finished eating? Now you realize that you have to check this patient and make sure that the patient eats what he's supposed to eat. Now many students choose C, said when shift change. When shift change, now ask yourself a question. Are you the one coming into the shift or are you the one going out? Now, if you are the one going out, so that means you have finished taking care of your patient, still you didn't know who your patients are. Now, if you're the one coming into the shift, you want to check or identify all your patients. Maybe that question, because some students say, well, the thought is like when they are coming into the shift. But this question, the option didn't say exactly. Is it when you are coming or when you are going? Now, let's take these two, C and D, as our options, the one we have to choose. Now, ask yourself, between C and D, which one is better option? Think about safety here. Is it when shift change or before you give your patient the food to eat? Remember, when shift change didn't specify which shift. Is it the morning shift or is it the outgoing shift or the incoming shift? But either way, during that period and before you give your patient food to eat, which one is of high priority? Think about safety. And the answer is D. Do you want to give patient food without identifying your patient, without making sure that the patients you are giving the tray, that actually that food belongs to that person? If you don't do that, probably you're gonna have your 10% of your patient to choke, because if you give your patient who's supposed to eat a puree diet and you give that person regular food, you know the problem you're gonna cause right there. So the answer is D. Use elimination method. Now, if you have questions, you don't know the answer, what I will tell you is starts from the wrong options. Looking at the question, looking at the options just like that, you might not get it. Now you don't know the answer quite all right. But what if you start eliminating the questions? You might be able to eliminate 3 options here that you know for sure that they are not right. And that particular one that is confusing, of course, is the only one left alone. And that should be the right answer, because the other 3 options, you know for sure that they are not right. Even if you don't know what D means, but you know what A, B, and C means, and you know that they are not right, But D, you don't know, maybe there is big word there that you don't understand, or maybe it doesn't make sense to you. But the three, A, B, C, that makes sense to you tells you that they are wrong. So why do you still want to choose A, B, or C? So the answer is D. I hope this part 2 of CNA test taking skill will make a little sense. And if you think this video is helpful, like and subscribe. And just keep watching and put the notification bell, because very soon we'll start having multiple questions to go over. We'll have to answer the questions and maybe have the rationales why that particular option is the best. I hope you like this video. If you like, subscribe and hit the notification button. And if you think there are things that I need to discuss on this platform, please just give me a note so that I will know exactly what you want me to post next time. Thank you very much.